First of all, it's important to identify patients' risk factors for developing peri-implant diseases, which are smoking. So then you can explain that stop smoking or a smoking cessation protocol can be beneficial. Second, we have insufficient oral hygiene measures, and again, the patient can improve oral hygiene or has to be instructed to improve oral hygiene measures. And we have the third risk group, which are patients with a history of periodontal disease. And in this patient group, we have to ensure that increased probing pocket depth is reduced and eliminated at the time point of implant placement. The major aspect in diagnosing peri-implant diseases at an early stage is that we ensure regular recall, which is at least once per year, and during this recall we should ensure that probing pocket depth is ensured also around implants. When we have an increased probing pocket depth and bleeding on probing, suppuration or pus, we obviously have to take an X-ray in order to find out if we have peri-implantitis with bone loss or if it's only restricted to peri-implant mucositis within the mucosal portion. For both peri-implant diseases, peri-implant mucositis and also for peri-implantitis, we always start with a non-surgical protocol. First of all, to ensure that the patients are able to clean properly, we have to adjust cofactors such as closed interdental spaces. They have to be open to ensure that the patient can indeed conduct oral hygiene appropriately. And after a period of non-surgical treatment, including also removal of soft and hard debris, we re-evaluate the situation, and we have continuing increased probing pocket depth with signs of inflammation like bleeding, suppuration or pus. Then you have to consider a surgical treatment. The surgical treatment can be either resective, ending up with some sort of resection, maybe even showing part of the titanium portion of the implant, while the regenerative approach aims at maintaining the mucosal tissues and the bone at the level it has intended to. Well, actually I think today the osseointegration in itself is no longer an issue. We know that the acid edge surfaces integrate very nicely, even in more cancellous bone structure. The transmucosal portion, consisting of the connective tissue and the epithelial compartment, should provide a seal, a protective seal against bacterial toxins from the biofilm. And I think this portion is the one we should focus at, also in our research. I'm convinced that it's worth investing in surface modification in the transmucosal portion, because this is the critical point today. In addition, it's important to invest in education of dentists, education of dental hygienists, and in the information of the patient, that they know about the risks and merits of implants and the importance of keeping and maintaining implant health.